We've been working alongside community organisations to understand what gives people a sense of belonging and supports them to live well within the place that they reside.
The InvolveD project has been about trying to find ways to engage with communities to find out about what would help them to live well in their neighbourhood, in their community, if they or a relative is living with dementia.
We wanted to keep it really light and engaging and fun and something that people could take part in a really interactive and a creative way. We gave them loads of materials and we asked them to draw a picture of what represents a happy life to them. We said, don't worry about the drawing, just show us or tell us what's important to you to live a happy life.
These are communities that are often neglected in terms of research, so we wanted to hear from them about what would help them to live well.
The main problem being that services still weren't seeing people from ethnic minority groups come and use their dementia services and didn't know what constituted good place-based support for people.
So right at the very start of the project, we started working with local community groups. Without them, we'd have never reached into those communities that are already trusted. They became a gateway to help us recruit people to come along to our workshops. Reassurance generally comes from people that you know and trust. We started off with a warm-up exercise. What made them happy in life?
Cloud nazar aa raha hai, hill nazar aa rahi hain. Imagination, not my garden actually, but this is my imagination. ਆਹ ਜਿਹੜੇ ਫੁੱਟਪਾਥ ਜਾ ਰਿਹਾ ਬੈਕ ਤੇ ਆਰਾਮ ਦੇ ਨਾਲ ਮੈਂ ਬੈਠੀ ਹਾਂ ਇੰਜੋਏ ਕਰ ਰਹੀ ਵਿਦ ਦ ਮਿਊਜ਼ਿਕ ਐਂਡ ਮੇਰਾ ਡੌਗੀ ਜਿਹੜਾ ਨਜ਼ਦੀਕ ਬੈਠਾ ਮੇਰੇ
We then asked them to draw a representation of their neighbourhood and the things in their neighbourhood that help them to feel they belong there, and if there were things that were missing from the neighbourhood that they would like.
So naturally we started to see people drawing their families, putting pictures of food, travel, because back home was an important part of who they are, greenery, having a secure home. And some people naturally started to draw roads, the ideal happy world of leaving their house, safely walking to the local supermarket, having a library, a place where they could socially get together.
There was just this fantastic energy in the room where people were sitting around their tables having these brilliant conversations, but you could feel the energy, you could feel the exchange of ideas going on.
And people got really creative and had a lot of fun with it. It just did not feel like research. It felt like I was giving the community something fun to do. And also people who did have a diagnosis of dementia were contributing. So in that way it was also inclusive. When we look at the image, we all know it's a house. We all know that's a tree. We all know that's a road. So it felt really inclusive. We had hundreds of images to go through. So as a team, we did what we call a thematic analysis. So we said, what are the key themes that are coming from these images? Rather than writing all these key themes out, we wanted to be creative in the outcome. So we developed an illustration of everything people were saying, remembering that this is also a participatory project. And we took that back to the groups that developed the original images so that it's not just our version of what we think they said. We put people into groups and said, take a look at this map. What's missing? What could be added on here? What shouldn't be on here?
I think ideally if you're Jamaican, we would like to have a Jamaican carer because if they are an Indian, because you know the culture, you know how to communicate, you know the needs and the wants.
ਜੇ ਤੁਸੀਂ ਲੁੱਕ ਆਫਟਰ ਨਹੀਂ ਕਰ ਸਕਦੇ ਉਹਨਾਂ ਨੂੰ ਕਿੱਥੇ ਭੇਜਣਾ ਡੇ ਸੈਂਟਰ ਹੋਣੇ ਚਾਹੀਦੇ ਆ ਐਂਡ ਡੇ ਐਂਡ ਨਾਈਟ ਸ਼ੈਲਟਰਸ ਹੋਣੇ ਚਾਹੀਦੇ ਆ ਜਿੱਥੇ ਫੈਮਿਲੀ ਕਾਂਟ ਕੋਪ ਹੈ ਨਾ.
We didn't set out to make an illustration. We just thought that we would be analysing all of the images, thinking about what's similar and different. But actually, the drawings were so illustrative. It just would have been a real shame to not pull that together in one place so people can see what they have produced collectively as a community.
So here we have a drawing that has been built on the drawings that the people did in the workshops. They said, these are the things that are important to us. What we've done is taken those things and we tried to put them all together. So you'll see that there are places of worship, culturally appropriate shops that they go to, markets, supermarkets, the bank, and of course we have health and social care services on there as well. We have on here 2 aeroplanes. They represent maintaining their sense of connection with their homeland. What's really interesting is that it's about people's everyday interactions. That's what community means. That's what a sense of belonging and connection and a good quality life means to people. Things like health and social care services were mentioned, but actually those kind of services were on the edge of people's everyday community. They're important to them, but they didn't want their whole life to suddenly be structured around a series of appointments. They talked about wanting to go to the local shops, going to the market, to the place of worship. They talked about wanting to carry on doing these things and not for them to be turned into dementia activities. If you look closely, you'll see these figures that have hearts around the back of them. And we've called those community mobilisers. They are people who are already in their communities. They are trusted. They're really crucial people for building a better community support infrastructure. The illustration is not meant to be a map of the perfect community and the perfect services. It's meant to illustrate a number of principles. People's community and sense of belonging is not purely based around infrastructure. Actually, people's community is lived every day. And the more you look at the map, the more you see things in it. And that's what community is about. The more you look at community, the more you see there's this whole different web of interactions going on.
But it's important to talk. Yes. Yeah. So you can hear from another person. Yeah.
This is why we didn't put too much onus on what do you need from a dementia service. It's what do you need to live a happy, fulfilled life. People weren't talking about a commission service, for example. They wanted to be able to safely go for a walk. They still want to go to their yoga groups. They still want to be able to go to the library. People want to carry on living the life that they're already living. So it really makes us think differently about the way in which services are commissioned.
We have modelled the way that partnership could and probably should operate beyond the research project. One of our challenges is how do we work with different decision makers to help make that happen in communities. But hopefully we can start to see some small changes, some small improvements to people's communities.
No friends came ever to the house. I was just lonely.
One of the outcomes on this project is to ensure that we increase the collaborative dialogue between members of the community and people responsible for commissioning dementia services. And that to me has been the biggest benefit and impact of this project, is to be able to have that collaborative dialogue, which we don't usually see.